everyone, this is Claire, Astor Nardich and Dentaltoaster. So today we have a guest. He's been practicing about 5 times more than I did in dentistry, and he has so much experience, not just in general dentistry, but also in specialty. And you'll discover he's done so many things that you'll be like, wow, Robert has been practicing 51 years. He's also been a faculty at Northwestern University, and also been mentoring a lot of dental professionals out there. And I just really feel like he has a big heart, not just for our young grads, but for everybody in dentistry. And I think his stories, everything that he's going to tell us today, will be some wisdom that we can take with us. So welcome, Robert, for being here today with us.
Well, thank you. I'm happy to be here with you. And it's nice to know that everybody's safe and healthy out there. It's a unique time. As much as I've been through over all the years, I've obviously not encountered anything like this. Probably the closest thing would have been what we had when the HIV threat it dropped on the office. And that was, I think very similar from a standpoint of the barrier protection, but there were significant differences as well.
Yeah, well, Robert, let's jump right into that. I love this conversation. And you are also, I didn't mention, one of the founding members of the American Academy of Cosmetic Dentistry. So Robert has just, again, so much to share with us. But going back to that HIV, so before that, you didn't have gloves. Is that correct?
No, we were using gloves. I would say when I first came into practice in my early years, when I came into dental school and out of dental school, no, we were not using gloves. Gloves weren't used in dental school. Masks weren't used in dental school. We wore our dental school gowns, but when you went out to practice, you just wore a nice shirt or shirt and tie, And,
oh, you did wear a shirt and tie.
For sure, And then slowly gloves came into the picture prior to HIV. But HIV ramped up everybody's let's say barrier protection for themselves. Believe it or not, I gained a lot of patients during that time because I was one of the few practitioners in my area that were willing to take them on. A lot of people found excuses, because you couldn't really tell a person with HIV, I can't see you, but they would find reasons not to see them and so forth because they were scared. They were afraid to have them in the office. They were afraid to touch them. But if you studied it and you applied the knowledge and the science like we're doing today, it was very safe. And we ended up seeing a large proportion of people that, and we saw them safely for many, many years. But that is probably a precursor to what we're doing today and so forth,
Okay.
I think, go ahead, I'm sorry.
No. HIV and a lot of us young grads, we don't really have that background of working in the 80s, right? When that really just peaked in the United States.
Right.
But even right now, though, even if we think about HIV, sometimes we can be alarmed and say, I don't want to see the patient. It's just like emotional, it's just psychological. But in fact, in dentistry, our standard precaution or barriers protect us, correct?
Very much so, and it's going to be even more so now, because with HIV there was always the fear of contracting that the patient would pass it on to you and so forth, but unless you were practicing unsafe habits in the office or in society, you were not likely to get it. Obviously, with the coronavirus, you could be standing next to somebody and they can breathe on you, you can get it. So it's a whole different world. But the precautions that we have, and I think that the CDC has already indicated that we as an occupation are very high risk. And there's going to be some unique ideas as to how to practice. I think we just need to study and be aware of those and implement those and so forth. The barrier protections we have, if they're put on correctly and taken off correctly, are going to protect yourself and your staff and your other patients and so forth. So it's just a matter of studying very much and knowing exactly what the protocols are and making sure they're in place. You should have no fear.
Yeah. All right.
I'm still around, so
I know after all of that, you're still around, and
yeah.
I would love to talk about that. So, in 51 years, what have
Okay.
you seen? Some of the things that you can share with us.
Well, I think probably the major area would have to be in restorative materials. You know,
Mm-hmm.
I mean, the transition from silver amalgam to composites
Mm,
would have to be the most significant aspect
I
of
see.
it, and so forth.
Mm,
Uh, when you think in terms of the fact that, again, going back to the state that I was practicing without gloves when I first practiced, in the evening, after seeing a number of patients and doing silver amalgams, we used to squeeze the mercury out of the amalgam with a muslin cloth. Okay. And that was before the capsulated amalgams came along and so forth. You put pellets of the silver tin alloy into a pedestal, and you put mercury, and you mess it up with the old pharmacy way of mortar and pestle and so forth. And then you took that and put it in a muslin cloth, and you squeezed it. You squeezed out the mercury. So I
mm-hmm.
would go home at night. My fingers would be black from mercury, you know, and so you start that, and now you take that to the today when we have everything encapsulated, and we're putting in the aesthetically pleasing
Wow.
restorations that we are, and so forth. I mean, it's a huge transition and so forth.
Okay.
But being along the ride and helping develop the materials, it was fascinating and a lot of fun, you know.
Wow, so mercury, that's so crazy because nowadays, I mean, everybody just, even patients, they know about mercury, they freak out if it's not
Right.
encapsulating, even the little bit of vapor that, we say in the environment, we all are scared. And
Well,
but you're well, so
you really don't need to be, because the research and the
hmm
papers out there have
hmm
discounted that over and over and over again,
hmm
and so forth. And I would say to you, if you're going to use that, you can think in terms of the fact that there's still a good population of us that started out in practice and we're doing
yeah,
silver fillings that way, and we're all here and healthy and not affected by it
yeah.
and so forth. So once it gets bound up with the silver tin alloy, it is not the dangerous poison that a lot of people want to
Okay.
promote, you know. So
Well, I definitely
don't worry.
see you well and healthy. How are
Well,
you
thank.
feeling today,
Oh,
though?
I
You're
feel
feeling
great.
good?
I feel great. I just, I think, you know, for me, every day is a gift, and I wake up every day like it's Christmas. and
You are
uh,
great.
I just well, because every day offers something. They're not always fun, but they offer something, and you either you learn and you adapt, and it gets better and better all the time.
Yeah, well, thanks for this spirit because it's a hard time right now, especially if it's young grad, if not a young grad too, because a lot of friends own practices or
Sure.
they work, and even one of my best friends, she's a dentist, recently
Hmm.
graduated, and she's about to be laid off because they can't pay her anymore. So
Right. Right. Right.
thanks for being in good spirit.
Well, I think that the part of being, I obviously am not working now either. I haven't for over a month. I think it was around March 16th or so that my state, which is Illinois,
Right.
mandated that offices close except for emergency patients and
Hmm.
so forth. I have tried to keep some people at bay, you know, using antibiotics and cover them for that standpoint. But now this week we've formulated a plan to get back to work, and we're going to see for a couple hours. We'll see some emergency patients coming
Okay.
up this week. Uh, the transition. I mean, I understand a new grad that doesn't have a whole lot in the bank and has put out money for a practice, or obviously
Mhm.
has school loans. It can look very daunting at this point,
Yeah.
you know. Uh, I think that for all of us when we started out, it looked daunting for one reason or another. The I wish I wish I could give the ability of fast forward to so many people and let them see that it is all in the long run. You
Right.
know, the old adage of it's not a sprint, it's a marathon. Uh, it's going to work out very well. We're in a tremendous profession. It is not going to go away. It
Mhm.
is always going to be needed. And if you take the time to position yourself as one of the better clinicians out there, you will be very successful.
Okay. Well, it's a small bump.
Yes, I would say, it's it's a free time. Well, look at it this way. Everybody can look at it this way. Now you know what retirement feels like, and you probably don't want to do it.
I love it. Oh my God, that's such a good idea just to think about it. Yeah, you're bored,
Yeah.
our mind needs to be stimulated, our body needs to be stimulated. That's why you're not retiring, right?
Oh, I think that, I see other colleagues my age who have quit practice and retired and
Mhm.
perhaps moved to someplace nice or still stayed around the area and so forth. And the deterioration and the aging I see and the lack of interest and the brain activity, it's very apparent, so
Well,
uh,
obviously you love what you do. You
I
love
do.
dentistry. You started over 50 years ago. You went to Northwestern first,
Correct.
um, got your doctor of dental surgery,
Correct.
and then you continued with a specialty, right?
Well, that was the pediatric one that I needed to do to practice with Norman, because so he
Mhm,
kind of arranged that at Marquette for me, and
mhm.
I accomplished and got that at the same time for the practice we were doing, because our practice was limited to children, obviously, at that time.
Okay, awesome. So you have this experience, and then some really interesting things is that you've been in like clinical trials for the original occlusion sealant back in the days, and
Right.
also for composite bonding and
Correct.
veneers as well.
Correct. Right. Right. No, that was just an extension of the sealants. It started with that, and then the innovators of the
Mhm.
material said, "Well, geez, we can make a filling material out of it." So we trialed that, and then we were trying to use it to let's say treat fractured teeth and so forth. And then they thought, well, gee, if we're doing that, we can do a veneer.
Oh,
And one of the first types of veneers that came out, if anyone will remember out there, were called Mastic Veneers, and they were really a box of shells that you tried to find a shell close to the existing tooth structure, and then you literally lined that with composite and then put it over the labial surface of the tooth, and that was the veneer. You peel off the shell and then polish it, and that was it. And then of course the labs got involved and came through with the porcelain veneers that we enjoy today. They're so wonderful.
I see. Oh, I can see now you describe it that way, that there is a continuum, there's a relationship between all of those materials you talked
Correct.
about, the
Right.
composite
Right. Right.
sealant to
Yeah,
the.
because we found out more and more about the material. We said, oh, can we do this with it? Or can we do that with it? And then we got further. Then the orthodontists got involved and could
Mhm.
find that they could attach their brackets with it and so forth, and
Mhm.
they then came in, there was the invisible brackets that came along. So as you say, that was probably the major dental innovation of the last part of the century that led
Wow.
to where we are today, so.
And you've been involved in that. When was that, Robert, when you started to do those initial studies?
When was it?
Yeah,
Early 70s.
early 70s.
Yeah.
Okay.
Hmm.
So before that, we didn't have sealants.
No,
No.
no.
So the decay rate was probably higher back then.
Oh gosh, yes. In other words, it's interesting because I often tell people that, today we're looking for a staff that is very inviting to have people come to the office. You're looking for that charisma or that magnetism to have people want to come to your office. Back in those days, we used
Yeah.
to hire a front desk person that scared people away because it was so busy and you were so overloaded that you didn't need to generate that kind of marketing expertise and so forth. And the one other good thing is people never fail an appointment, because if they failed an appointment, they never got another one, and they knew that. So it was a different time. We were swamped with work, adult wise and
Mhm.
children wise, and
Mhm.
then you got adult dentistry is predominantly just redoing all the work we got when we were kids and so forth. So there was there was more than enough to do for everyone and so forth.
Oh,
So
wow. I never thought of the, in a practice setting as well, how those tools could really change the way you do business, how you see patient, and
right.
what patient come with.
Right, right. And because of the decrease in the number of caries teeth out there, also associated with fluoride, you
Okay.
know,
Okay.
the need obviously decreased, you know, and so
Mhm.
forth. And that coupled with the fact that the dental schools, you know, started to graduate a greater number of applicants and so
Mhm.
forth, uh, turns out not to be the best ratio for today's world. So it makes it difficult for young people to go out and get going with their practice.
I love hearing those stories of, when I wasn't around or I wasn't practicing at all.
Well, yeah, there's, well, I could have some real stories for you if we were in a different setting. Some of
Can't
the
wait.
things,
Robert,
some of
when
the
I go to
things that have happened
travel,
to me.
I would love to take you out for lunch and then, get the
Oh, we'll
stories.
do that sometime, you know, because I
Good.
understand you're in Vancouver, right?
Yes, right now, actually, right now, during this coronavirus,
Uh-huh.
I'm in Toronto.
Oh,
This
okay.
is
Oh,
not my
close.
home. This is kind of just
Okay.
background because
Okay.
I live in a tiny apartment.
Okay.
And
Because I thought I'd read someplace that you were in Vancouver, and it's probably one of the few cities I have not gotten to in my whole career. I've probably been to every other city. I thought, oh, I'd love to come to Vancouver.
oh,
So
you have to. You have to. I mean, there's a
someday I
big
will.
dental conference called PDC every March.
Oh, okay. All
Oh,
right.
you have to come. And
Well,
the
next March, if everything straightens out and so forth, I promise I'll come and we'll have a
right,
chance to
yeah,
visit
yeah,
even
yeah.
more.
Perfect. Oh, I'll show you around there. Stanley Park is beautiful. Are you an outdoorsy person? Do you like the water and the mountain?
Yes, I do. Yeah.
Okay, perfect.
My
There's
my
plenty of.
hobbies over the years have been sailing and skiing and scuba diving and
Oh, you are
golf.
active.
Oh yeah, yeah. No. Well, I've always viewed life as a buffet, and we only get one shot at going to the buffet. So I wanted to try everything. You know.
And you want
So
more of those things from the buffet, scuba diving, skiing, and
right, right,
okay,
and
very diverse.
just
Okay.
all kinds of things.
Okay. Well, Vancouver is a great place for all that. I mean, not scuba diving, but you got the beach, beautiful sunset of the West Coast, and then you got the mountain right there. We'll have fun. And
Okay,
also learn dentistry.
all right, that's a deal.
Yeah. And you were also involved as one of the founding member of the American Academy of Cosmetic Dentistry.
This is true. Yes.
Right.
Yeah.
When was
Uh,
that?
well, there was a number of us who were early on were using the composites when there was some opposition to composites. The insurance companies would not accept them. Number one, and secondarily, dentists are, they don't move quickly to new and creative things, or at least they didn't in those days. Everything was, oh well, we did it this way for 20 years. We should still do it this
Mm-hmm.
way.
Mm.
So there was a small group of us from around the country who were working with these materials and saw the benefits and the value and the future of it and so forth.
I see.
And we communicated, and we finally decided to, that the hodgepodge that was out there, that it would be nice to have an academy that set some standards and
Mm-hmm.
tested materials and
Mm-hmm.
gave results of those tests so that
Mm-hmm.
the dentist could tell. So we met in Las Vegas in like 1985, and
Okay.
we formed the academy at that time.
All right. And today it's big, right? You
Oh
have
yeah,
members
yeah.
from everywhere. Back in the days, you just thought that
There,
is a good idea. Just few of you got together.
right, right. There was like 12 of us, I think, that got
Mhm.
together that initially started, which is, I think, true for most academies or most things and so forth. And then it grew from there. That's for sure.
Yeah. How do you think things have changed in the cosmetic world? Because it's called cosmetic dentistry. So,
Right, right.
I think, nowadays, I mean, we see celebrities. We're very, very concerned about cosmetics. Even
Right.
myself, I do whitening.
Right,
That's about
right.
the cosmetic things that I do.
No, I think that's very true, and I think it's been an amazing boon for patients and for ourselves. It's interesting to do. It's fun to plan. It's exciting to prepare for it and to deliver it and see the smiles on people's faces the smile they wish they had all their life. I mean, it's it can be life changing. I'll tell you a story regarding that in a minute, but. Um, I think mostly what has changed are the materials. The materials have just gotten better. They've gotten stronger. They've gotten easier to work with and so forth.
Yeah.
Some of the techniques are quite a bit similar to where they've always been. A minor change here or there, a little wrinkle here or there and so forth. But I would say that the biggest change has been just the technology of the materials and the advancement of that and so forth. But going back to how important a smile is, I had a lady come into my office one day, and she sat in the chair, and we were seeing her for the first time, and she had a lot of enamel dysplasia, and she wanted a new smile. And here's something for the new grads to say. I mistakenly had categorized her as not having the ability to pay for a new smile. And I would caution everyone, don't ever do that, because you never know.
Okay,
don't. The reason I had done that is she came in a rather shabby dress, and quite honestly, I almost thought she was homeless. No makeup, hair a mess, kind of not particularly super clean. And so I said to her, well, I had decided that she couldn't afford to have a new smile. So we tried to patch her up and give her an improvement just using composites and making it very reasonable for her to have and so forth. And it was okay. It wasn't the greatest job, as it never is if you're trying to do just composites, but it certainly made a dramatic change in her smile and so forth. And she came back about 6 months later, and she said, well, you said you were going to change my smile and so forth. Now, I will give you this, that she came in, and her hair was done. She had makeup on it. She had a new dress, and she said, I really need a new smile to accomplish what I want to do and so forth, So I said to her, I thought, okay, I'm just going to take a loss on this. I know I'm going to do this. I know I'm never going to get paid and so forth, but I'll take a loss.
Okay.
So I did a whole set of veneers for her, and it looked great, looked beautiful.
Okay.
And lo and behold, as we're done, she said, I know we said it was going to be this amount of money. She said, no, I'm sorry, but, and I thought, okay, this is the usual, I'm sorry, but I don't have the money, or I don't have it. And she pulls out of her pocket
bills,
a wad of cash, and starts counting them off. And she says, no, I wasn't able to get to the bank to get you the last $100, but I hope this is okay. I'm going to go to the bank now, and I'll come right back. So I was just blown away by it, of course. And I still get emotional about it. She came back, and she would continue to see me and so forth. I want you to know she finished high school. Now, she was maybe in her 30s when this happened. She finished high school. She went to college, got a degree in psychology, got her doctorate in psychology, ended up being the head of the psychology department at National Louis University in Evanston and so forth. And if that isn't a success story, and I know she always said, but it's because of my smile. So yeah, that one was really emotional for me.
Wow. I can see it. I can feel it from you. So, what we do in dentistry is a lot more than just fixing teeth, or it's very personal, emotional. So there's something there that you can't really calculate with numbers or even words. You can't even describe it in words.
Well, and that goes along with probably one of my cardinal rules for being successful in dentists, and that is to listen to your patient. Too often all of us have something that we want to say, or we want to sell, or we want to do.
Right.
And we don't tend to include the patient as far as listening to what they have to say and what they're interested in and so forth. And one of the biggest complaints I always heard from people is that the last person I was with, they wouldn't listen to me about this. They wouldn't do this. Now, some of them are annoying. I won't, I'll be the first to say they were to me, but I would always guard myself to not appear to be annoyed. Nothing was too trivial, or nothing was wrong and so forth. And you then start to make a connection with people. So if your goal is to have a private practice that is not insurance driven and not an assembly line and so forth, this is where you have to concentrate and focus on the patient when they're there and pay attention to them.
Okay, good. You know, I think this is a really good lesson even for me and especially our young grads, because I think we're so focused on like, we need to give them this. This is wrong. There's this education we need to give them, especially as a hygienist. It's like, you're doing A, B, C, D, and E wrong.
Right, right. And then you have to, what you have to do is you have to prepare yourself to be able to, I suppose the crass way of saying is to sell. I've never thought of it in terms of selling, but selling and persuading are probably the same word in different contexts and so forth. If you want to read an excellent book on how to approach people and to motivate them to your line of thinking and so forth. This was written a long time ago. It's by a man named Ziggler, Z-I-G-L-E-R. And he was a renowned salesman and so forth. And I think his best book is one called Ziggler on Selling and so forth. He coined the phrase, you sell the sizzle, not the steak. In other words, when you're trying to sell something on to someone or promote something to someone, you're not just promoting a piece of meat. You're promoting the whole emotion of the steak, the smell, the flavor, the sizzling. And you can transfer that to dentistry in a lot of ways. Probably one of the more helpful books I have ever read. So I would encourage people to find that and read it. Ziggler, and it's Ziggler on Selling. It's around, you know.
We'll share that. And so can you, you've been doing this for a long time. So for us, especially young grads who have a hard time understanding that also dentistry is also sales.
Yes.
Is there some mindset that you can help us with?
Well, I think certainly talking about what I did about the thing with Ziggler, you have to listen. That's the first thing you have to do. So often we all get self-important and pretty pumped up about ourselves, and we want to tell the patient this, and we want to tell the patient that, and so forth. And we of course know the reasons that something needs to be done, but it's not always apparent to the patient and so forth. And so you have to step back and listen to what they're asking, and then find a way to tell them why what you're doing is going to be of value to them. You can't say to them, you have to do this because this is what the textbook says. You have to do this because this is what I've learned, and you got to do this, and so forth. You have to find a way of convincing them that what you would like to do is going to be of a value to them in their life, in their health, in their discomfort, in their comfort, and so forth. And that is probably one of the more important things I've learned.
Sure. So it is the value to them, not like, I learned this, this is the way how we do this, this is the research, the research is saying this and that. It's like, it's going to be feel like that to you, the sizzle about, this is what it's going to look like afterwards.
Exactly. I mean, they're not impressed with what we are impressed with. They didn't go to dental school. They didn't learn all of the A, B's, and C's like we did and so forth. And because we're committed to it and we feel so strongly about it, is great, because that helps us treat people in a appropriate and professional manner. But you have to change the delivery to them to help them understand how they are going to enjoy what you're doing.
Yeah. No, I love that. I love that you said delivery, because it's like just a small piece, right? We don't have to change our entire mindset, but we just have to change how we deliver this information to the people.
Right. And interestingly enough, here's a side point that I learned along the way, and you'll probably be surprised at the conclusion of this, but in the hierarchy of an office, so let's say a front desk person, a chairside assistant, a dentist, and a hygienist, who would you say is most important?
Ooh. Okay, we have the dentist, the hygienist, and the chairside assistant.
And the front desk.
And the front desk. Yeah. I mean, in general, the dentist is the most important person.
Wrong.
The front desk.
The dentist is the least important person. And I'll tell you why.
Yeah.
The most important person, believe it or not, is the chairside assistant, or I would refer to it as the chairside associate. Okay.
I love that term.
The reason being is the patient looks at the hierarchy of the office and they see the chairside associate as the least invested in what happens with the treatment. They're not going to get money from it. They're not going to get this from it. They're not going to get this from it. Going on up, the next would be the front desk, because they've been the ambassador that's meet the person and they've gained a relationship from them, and they certainly are trying to help them and so forth.
Sure.
All patients will look at the hygienist and the dentist as trying to sell them something.
I see, I see.
And they're always going to be cautious about it. I can't tell you how many times I've walked out of the room after talking to a patient about treatment and something that needs to be done, and I'll hear them turn to the chairside associate and they'll say, well, what do you think of that? Okay. What is your opinion of that? And so forth. So you can use that as an asset, because you can get someone in that position that has very good people skills and understands how to communicate with the patient. And if they are on board with your vision and they believe in what you're doing as you do, they will be very convincing, and they will be the person that will close the sale for you 9 times out of 10.
I see. Yes. I mean, totally.
People don't think about it that way, but it really is, you know, you have to think about how the patient's looking at it and so forth.
Right. And I mean, even me too, when I go to a doctor and I turn around and I ask other people, but the doctor is not there anymore.
Right. Exactly.
So yeah, those are the front desk especially. I'm like, do you think it's a good idea? I always do that too.
Sure, we all do. And so,
you know.
Yeah. So when you're building your office and you're building your practice, keep that in mind. You always want to look for staff members that have people skills.
All skills.
I've always said that that's one of the things that are very difficult to teach. You can teach almost anything else in the office. You can teach instruments, you can teach techniques, you can teach all that kind of stuff to almost all of us. It's very difficult to teach people skills. People either have it or they don't, usually, and so forth. So you want to look for those people in your job interviews and in your hiring and so forth. And so I've even gone to the extent of, if I see someone out in the in society, when we used to have bank tellers, I guess we still do, but not as much, but the bank teller or a waitress or somebody I bumped into, and they had great persona and great charisma, I would say to them, well, are you happy with your job? And you know, they might say yes or no. I don't know what it was. And if they'd say yes, I would just comment and I'd say, well, yeah, you show it to everybody. It's so great to see somebody happy with their job. And if they say no, then I would approach them about coming to work for me.
Wow. Okay. Lesson right here. Let's be proactive. It's not limited to putting a job on the job board saying looking for an assistant or front desk. Those are all teachable skills. The people skills is the hard part. Correct.
Right. Okay. And that's the most important value and asset you can have in your office and so forth, you know.
And is there something that you've done to, you know, help others get more people skills, or even yourself? Anything that you can recommend?
Well, I think that, you know, reading books outside of dentistry is very helpful and very informative. The one I just mentioned by Ziggler is I think, very informative for people. And anything you read in the area of psychology or how to read people. There's books out there and say how to read people, or how to, all kinds of how-to books and so forth that are not necessarily considered dental books and so forth. And there are certainly continuation programs and seminars and meetings that will have programs in this regard, and they will tell you about it. So, and just talk to, I mean, if you see somebody that has in your area, in your town, that has the practice that you'd like to have, you know, whether it's, you have to decide whether you want a volume patients or you want more of a concierge private patient type thing. That's a choice that everyone makes, but then you have to design your practice to be that way. You can't do both and so forth, you know. And so I would say that you could always stop and talk to that dentist. Most dentists are very giving in your in what they're, if they're not, okay, they're not. But the worst they can say to you is, no, I'm not going to share with you. But, you know,
That is fine.
most of them are successful and comfortable. And I mean, like I've been doing that for any number of years now with young people going into practice and young people who are starting up, or let's say have been in practice for a while and things aren't going quite the way they want and so forth. You know, that was really why a number of years ago, I kind of created a mentorship, you know.
Yeah.
It's actually called the University of Dr. Bob.
Yeah, I love that name.
Someone said to me, they said, Jesus, I should have went to you at school and not, I went to school and so forth. So if anybody is interested in that or more details, you can find me at drbobdentalmentor.com.
Okay, drbobdentalmentor.com.
Correct, right.
Perfect. Oh, you're so giving. You're so giving. I can feel it. I'm sure our audience is feeling it as well.
Well, I hope so.
That's the best way to learn, you know, honestly, when, you know, it's been about 10 years and I'm still like trying to just wrap my head around this big world, which is not just dentistry, sure, but, you know, work-life balance and all of this. And the best people to ask is people like you who are there, who've done that.
Well, and you have to balance. You have to have fun in your life. And if you could totally concentrate on work and practice and you spend 24/7 on that, you will not be the effective pro. One of the best compliments I get fairly routinely from my patients is they'll come back to see me, and so many of them will say to me, they said, do you ever have a bad day? Every time I come in here, you're in a great mood. You love to see me, and I look forward to coming here. I said, well, I'm glad of that. I came in looking forward to seeing you. You know, sometimes I'll tease them. I said, you know, I only opened the office today for you. You know, and they know that's not true, and they'll laugh. But you know, it's that they, in a sense, they kind of think that because you have to make them think that they're that important, and they'll just build and build. And they're going to be the best missionaries you have. They will go out and tell all of their friends. Oh my! You have to try to be. You have to be a little bit different. Whatever you can do to make yourself unique. I used to tell my staff that people drove by a lot of other dental offices to come and see us. So we have to give them a reason to continue to do that, so forth. So you just try to do things a little bit different or a little unique and so forth. At the time, we're talking about my hierarchy. When I built my first, built my first office that I wanted, I built it wide open. You know, there were very few walls. There were very few things. The rooms were minimally equipped. There weren't cabinets everywhere. There was just a central sterilizing area and so forth. We made the waiting room like a living room almost in a way. And people talked about that all over town.
Oh, really?
And because it wasn't done, now it's more and more of that is done, but at the time it wasn't and so forth. We had a lady one time come in at Christmas, and she came in, and we had a nice little desk with a glass top and a soft light. And she came in and she sat down and she pulled her Christmas cards out and she started writing her Christmas cards. And my front desk person came back and she said to me, she said, Mrs. Jones is up front in the waiting room. She said, I don't see her on the schedule. Did you tell her to come in for any reason? I said, no, I haven't talked to her in a little bit. She said, well, what has she? I said, well, you'll have to go ask her, you know, see what she wants. So she goes out and asks her, and she said, what is she? And Mrs. Jones said, oh my God, she said, this place is so warm and quiet and comfortable, and I'm so hassled with Christmas and so forth. I just decided to come over and sit down and have a couple of hours of quiet.
Oh, really? That's so crazy.
It was one of the best who goes to a dental office to relax and take it easy?
It's like a coffee shop or like, for her.
So that's the kind of environment that you like your decor and your room to place, and you want your staff members to. So we just said to her, oh God, please, can we bring you a coffee? Can we, anything? She said, you know, and said, please stay as long as you like. And that kind of stuff gets around.
Well, obviously she felt that you guys created this environment as well for yourself as well. So you feel good in that environment every day.
Right. No, this is true.
Wow. Okay. So, you know, I love this conversation because, you know, I do some interviews and just to help our new grads, including myself. Okay. And, you know, we get advice from everybody, but your kind of advice has like something really about like life. something, you know?
Well, this is, I mean, you know, we spend a lot of time in the office, and it's not always easy, as you, all of us understand, and so forth. And if you're not going to have fun with it,
Yeah.
it's going to be a long road and so forth. And I mean, here's another cute story that after I sold my one practice and hadn't started my other private practice, which I have now, I was working in an office for a while because they asked me to come in and help them organize and do some things, and that mentorship that I talked about. And they asked if I could be there and do it on site. And I said, yeah, I would. So I'd worked there for about 4 or 5 months, I think, and I took time off to go away for about a week of vacation. And I came back, and the staff was all, they said, oh my God, Dr. Bob, it's so great to have you back. God, we miss you. It's so wonderful. I said, geez, I said, you guys are really excited. I said, what, you know, what's going on? They said, well, you know, when you're not here, it's so professional.
So you're the unprofessional guy.
I said, well, I'm not sure that's a compliment. They said, no, that's not what we mean. She, you know, it's just so strict and staunch and everything. And I said, well, I'm back now, so let's have fun.
Wow.
And I just think I think that's something that we all need to do, is have fun with the staff and ourselves, laugh at yourself, laugh with the staff, and let them be individuals, and they'll work for you so hard you won't believe it.
It's the human aspect of life and dentistry, not just dentistry, but
I think that's the most important part. I think it's the part that gets lost, and we get caught up with techniques, and in this world we get caught up with so much of the IT stuff, and I see it pushed on young grads, and I'm thinking, geez, you know, you're just going to bury them with more money. They don't need that piece of equipment. They don't need that. They can still be successful, you know, what I call the old-fashioned way, and that's just paying attention to the patient and doing good that way, you know. So,
all right. Well, you know I asked a few questions earlier, but if there was a must to do, especially for our young grads to succeed, what do you think that would be?
Well, I think we've probably touched on it a little bit already, and as I said, and as I have said, and so forth, I think creating an environment, you know, where you make it comfortable and enjoyable for you and for the staff. You will minimize the hassles and the irritations. They will be happy to deal with them when they come and so forth. And I think that's most important, because if you're not going to be content and happy, and you're frustrated, and you show to the patient that you're worried about that loan, or you're worried about this payment, or you're worried about that, you're going to convey that to the patients, and they're going to realize that you're not enjoying or comfortable in seeing them and so forth, you know, that kind of thing. You just have to think of it as showtime, regardless of when on and home. I told my staff, one of the things we would talk about all the time was, when you come to work, I know you have problems at home. I have problems at home. I know this is going on. I know that's going on. I said, when you walk through that door, it's showtime. And I want your showtime personality and your effort and so forth, and show the patient that. And then the success will breed itself, and it will go on, that kind of thing. You know? You have to treat, and the other thing I would say is, every patient needs to be treated like a superstar. Think in terms of the fact that if, for the grace of God, Brad Pitt or Kim Kardashian walked into your office, think how you would treat them. And then turn around and think, do you give that same treatment to Mrs. John Doe or Mr. John Doe? And think about that difference in how you would do it. I think all of us would say we would have a whole different attitude and a whole different way of treating a celebrity or a superstar. You have to make every patient a celebrity.
And you know Kim Kardashian?
I don't.
I'm surprised. Like, you told me.
That's what I don't. I know a number of people like that, but she's one I don't know. No.
You know her younger sister, Kylie Jenner.
I do know of her. I don't know her personally.
Right. I'm just saying, you know, as a celebrity, because you don't look like that.
Yeah, no, I know.
Watch the Kardashians. Yeah.
Oh, yeah. My wife reminds me of them quite frequently.
Really?
She enjoys them, to say the least.
Okay. That's funny. Awesome. And then, you know, we talked about the please do, treat them like superstar, make yourself comfortable, and you have to share this, you know, awesome environment with your staff. What is some, like, please never do that in your life?
Well, again, we talked about that, and I think the don't is you can't lose the focus on the patient.
Okay.
You know, you can't trivialize what they say. You can't trivialize who they are, and so forth. Even if you're annoyed by the question and they've asked the same question 13 times, you've got to be enthusiastic and answer it 13 times, and you know, perhaps bite your tongue and say, but you've got to. That would be because if a patient leaves unhappy and you've made them unhappy,
right,
they're going to tell a lot more people than if you made them happy. You know, the odds are not good if you. So you really want to spend your time, and you want to have the ability to take every new patient and create a core patient, somebody that's going to stay with you forever. I mean, I have people to this day that travel to see me from across the country, from around the world, and even though I've moved the office, people that they have to drive a lot further than they used to see me, and they'll say, I'm not going to see anybody else as long as you're. I get people that call me and they're worried I'm not practicing anymore. And I say, no, I'm still practicing. And they say, oh, thank God, I don't know what I do. So you can create that in people. I mean, I just didn't, I just didn't find all those people out there in the world that came to see me. Those were people that came to me just like everyone else, but over time and being interested in them and so forth. And I mean, you can do a lot of little things. When a patient calls to set up an appointment, you know, I always had the front desk person, and today, of course, everybody wants to use the computer, and that's fine. But I used to have my front desk patient write a welcome note and just say, we look forward to seeing you, and if they want to put any details in there, remember your appointment is, and we're really looking forward to seeing you. Just a very simple thing, and send that out. And then after they were there for the first time, I would write a handwritten note. And I would say, thank you so much for coming to see us. I appreciate that you have trusted your dental care to us, and we will endeavor to be, and that kind of thing. And then the next thing I would do is I always had a call list at the end of the day that if somebody had major treatment or particularly stressing treatment like endo or surgery or something like that, or I had a big case, I would have my front desk person, I would earmark those, and she would give me a list on the way out the door with their phone numbers on, and I would call them in the evening and say, hey, I just want to touch base. Are you doing okay? Are you comfortable? Is there anything you need? And so forth. And 80% of the people I did that were so shocked that I took the time to do that and so forth. But that little call cemented a lot of patients to continue to see me forever and so forth. So there's tons of little things like that you can do. You just have to stop and think about it.
Well, in general, you know, what I'm getting is it's a really awesome environment. It's like humanized. Is that a good word? Humanized. It's like not like procedures and, you know, money and that, you know, this and science and this is the reason why you need that. It's people, is making the patients happy, working with them as people. And
you're exactly right. And that's what will make you unique, because there's too many offices out there that you talked about that are worried about, okay, the procedure and the insurance and the payment and this and that. Yes, that's important. You can't forget that sort of thing, because that obviously fuels and drives the dental office and allows you to do what you've been trained to do. But if you want to build your practice and you don't want to stay and just work for one of these new corporations that have offices all over the place, and you want to have now maybe some people do. I'm not saying you don't. You may want to just go in at 8 o'clock, punch in and punch out, and be done with it, not worry about it. But if you're desirous of having a practice of your own that people look at the old you know, model of what dentistry was and so forth, then you have to do these little extra things and so forth, you know, so forth.
Oh, wow. Thank you. You know, those are the things, to be honest, very honest with you, Robert, that, you know, I know, but I still need to hear it from someone like you.
And here's a way of young people to get started in their grads after they graduate. Let's say they come out of school, they don't have money to open a practice. Right. They don't have money to buy all the equipment or whatever it is. They don't have a cash flow to pay rent on an office. So they go to work for one of the corporation type things, you know. Fine, do that. but then find time on your own, days off and so forth, okay? Approach a dental office, and you can usually, perhaps, usually it might be somebody who is older and is at towards the tail light of their career and so forth and so forth, and rent the office space from them on a daily basis. Okay. So all you're paying is a minimum amount for that day for those supplies, and then you can start to bring people in to see you. Most of the time it's friends and family members that you know that you're going to see and so forth. And you can use that to slowly build your practice. And as time goes on, you can rent another day. You got 2 days and then 3 days. Then you can transfer that whole thing to your office. Now you can afford to pay for that office and pay for that equipment and so forth. And you can you're practicing the kind of practice you want, but you haven't had to go through the stress of paying for it. I had a young man, do that with me back in the early 90s and so forth. He happened to be, the husband of one of my hygienists at the time. And I came up with that idea. She kept saying, well, Steve wants to practice. Steve wants to practice. He doesn't know what to do. He's in this, grungy, Medicaid-driven practice, and he doesn't like it. I said, well, listen, why doesn't he just rent my space on a weekend and so forth? He took that and he built it just as I said. He now has an existing $1 million practice in the heart of Chicago. So it works.
Okay. It's like being creative too. The solution wasn't there. You figure it out. They work with you, and they also probably brought their own, twist to that. So that is great.
Well, that's why I think that probably besides being a dentist and enjoying that, I've probably enjoyed the mentorship thing. That I do more
it really looks like it.
Yeah.
Okay. So again, we find you at what? DrBobDentalMentor.com. Right. Perfect. Thank you. Wow.
We'd love to help any and all. That's for sure.
This is so awesome. So guys, if you have some ideas, I mean, there are people like Robert. Robert has especially so much experience that we have not even been able to talk about which includes, you working with, cleft palate and the TMJ clinic, you being the editor of the Journal of the American Academy of Cosmetic Dentistry. So that involves probably writing. Maybe some people want some tips about how can I start writing, right?
Right.
And also,
I'd be glad to help them.
You were the anchor moderator of TV programs for the dental.
Yeah, the Chicago Dental Society has their big midwinter meeting every day. And if you've been to it, you know that they have, what they do is every day, usually 2 a day, they have, they set up a TV studio in one of the dental schools. Illinois is the only one left now, so they do it at Illinois. And then they have a guest expert come in and do a procedure. Whether it's implants or guided tissue or whatever it may be and so forth. And then I and a good friend of mine, we started to do this. We thought we were only going to do it once, and we became so popular they'd never let us quit. So his name was Peter Leo. And then we would be, it first started out, we were in the Hyatt, and then of course it moved to McCormick Place, and we were in McCormick. So we'd be in a room with 1,000 people, and they'd have the TVs all over and so forth. And then so we would answer questions from the audience and back and forth, and we would talk to the educator. And if we saw him about to make a mistake, we might slip in a little hint about, well, wouldn't you want to do this first? And they'd say, oh yeah, I do want to do that first, So it was a lot of fun.
So you're the commentator, supervisor, kind of just taking questions from the audience as well.
I mean, it was fun because I'd walk around the meeting and people would say, oh, there's Mr. TV, so. So it was always fun. We enjoyed it.
Awesome. Well, are you still going to Chicago Midwinters?
I haven't been for a couple of years, to tell you the truth, but not that there's anything wrong with it. It's still a great meeting and so forth. It's just that I suppose in a sense it's like anything else. Some of those things you kind of passed, and you've been involved with it for so long that you think, okay, I've done this enough now.
Well, next time you just have to try the PDC in Vancouver.
That I would love to do, because one of the places I've really on my bucket list to visit is Vancouver. So I promise you I will.
Chicago, not very far.
No. Well, in today's world, nothing's very far, of course, that we may all be flying our own planes the way things are going, you know. So we'll see what happens.
Great. Well, but thank you so much, Robert, today.
You're welcome, Claire.
Dr.
It's a pleasure.
Sandusky,
I certainly enjoyed visiting with you, and Dr. Bob is fine. That's what everybody calls me. So,
okay.
So you have a great personality and people skills. You will be very successful.
Thank you. I just want to, you know, kind of ask some questions on behalf of our new grants, because, you know, the learning curve, I thought when I was going to graduate, I'll be like good to go, which really was not the case.
No.
And I'm still
I think as someone once told me, I think it might have been Norman, the guy who took me into practice with him and so forth. He said, actually, he says, dental school just gives you the license to start to learn.
Yeah, that's how I feel.
And it's very true.
Awesome. Well, thank you again for joining us from Chicago. We wish you the best. And I hope our listener found this really interesting, which it really was for me. So,
I do too. And you still stay safe out there, and you'll be back working better than ever in no time. Yeah. Sure.
Okay. Thank you again.
All right. Thanks, Claire. Bye.